Hello, Burke County Democrats. My name is Scott Donaldson. I'm running for Congress against Mark Meadows for the 11th Congressional District. There's a lot of talk about this is a very Republican district, but I'll tell you, I truly believe this is our election to win. Number one, we're seeing the Republicans have given us a tremendous tax burden, of which they've invested in apparently the most rich among us, leaving the rest of us to fend for ourselves. I think the principal thesis, the principal basis of this election will be health care, because this current system is unsustainable and it will not work. There's plenty of money in the healthcare system as we stand here right now. The money just happens to be in all the wrong pockets. The money's in the profiteers among us, the money's in these big insurance companies and even some of these big hospitals. That can change. I believe much of the healthcare infrastructure can be recreated with the money as it exists. My name is Scott Donaldson. I'm running for Congress against Mark Meadows, and I appreciate your support. So that was my stump speech. Now I want to talk a little bit about the movie we just watched called Fix It, Healthcare at the Tipping Point. And healthcare in this country has been at the tipping point for quite some time. It's just the tipping is getting a lot closer to the tipster. Okay, and I brought my beautiful daughter Celia to help me with a whiteboard. I've been involved in the healthcare industry my entire life. So let me explain it as I see it. So these are the American citizens right here. We all live from about the age of 0 to about the age of 95. Well, historically, Medicare breaks even or pretty much pays for itself. What happens, we've always had this gap, and we've always had this gap just because we've always had this gap. And we've used this gap to cover the people who don't have money. So we know, the insurance companies, Medicare know, and these hospitals know that there's a number of people around here who are never going to have health insurance as it stands right now. We've always been able to use this difference to cover these folks. Well, what's happening over time is the Medicare numbers are going down, the insurance company number, what they're paying us, are going down, but the number of people who do not have health insurance, that actually number is going up. So what's happening is much more strain then is being placed upon these hospitals. And remember, these insurance companies are doing most of the paying here. Who are they really obligated to? The insurance companies are obligated to the shareholders. They're not obligated to the patients that they cover. Truly, their obligation is to keep their business viable and get everybody paid. They have about a 30% overhead, as was brought out wonderfully. So the question is, how did we get into this mess? How do we actually get into this place where we had insurance which tends to pay a lot more, the government insurers which tend to pay a lot less, and this mess that we call healthcare in the United States today? Well, it all goes back to 1945, if you can imagine. Something called the Hill-Burton Act. The Hill-Burton Act was put together and basically provided loans and money, grants, to build these hospitals. And the government said you couldn't discriminate. But they did say eventually that you make them separate but equal. And these hospitals had to make economic sense. In other words, you couldn't put them in places where you couldn't pay the bills, right? Because how's the thing going to stay in business? So what that meant was that the poorer communities didn't tend to get hospitals. Then when Medicare came along in 1966, these hospitals, these Hill-Burton hospitals, had to take Medicare by law. Then what you happened to see was you had companies come to town, all right? Companies like GE. So we had, well, first of all, we had government money coming in. We had companies. For instance, General Electric. We got General Electric comes to town. And General Electric says, you know what, we're not going to pay you as well, but we're going to give you health insurance. So these monies started getting routed through Medicare, all right, getting routed through Medicare, routed through GE, and by 1966, first hospital was built in 1966, Medicare came into existence. 1968, we had a heart transplant. By about 1970, we cured the first cancer. That's testicular cancer, one of the first ones ever cured. And by today, HIV, when I was in medical school, that was a death sentence. Now it's a chronic disease. And it has to do with these hospitals that were built in 1945 and with the introduction of Medicare in 1966. But what you see in this is that the United States of America never said, we want to roll out health care to our entire country. We're going to do it in an organized fashion. What you see is they said, we're going to put health care in places where they can afford it. And what that did was it made a mess. England is much clearer, as much as Europe, because of a guy named Winston Churchill, who at the end of World War II said, the first thing we're going to do is find a way to deliver health care to our people. The United States of America has never done that. So this is what needs to happen to health care in the United States. It's really not that complex. This is what needs to happen. All of this nonsense and all this confusion needs to go away. It's just too complex. Let me give you an age breakdown. Let's go back to who we are as a people. We're all the way from the time you're born at 0 to the 95. There's a whole lot of people in this age bracket who just do not feel it's their moral imperative to provide health care to the nation. A lot of them watch Fox News. In these Fox News crowd, they would cut you just to watch you bleed. Democrats don't understand that, but it's true. And there's a lot of people who believe that it's non-constitutional. And these are very smart people. These are very smart people who just believe in this Constitution. But the interesting thing, the difference between our Declaration of Independence and our Constitution. Our Constitution was just a set of rules. These are things we govern ourselves. It took almost 10 years to write that Constitution because we're arguing about laws and things like that. The Declaration of Independence, I always think is beautiful because it tends to project a vision. The Constitution says, these are the things we're going to have to do to get along. The Declaration of Independence says, you know, we hold these things to be self-evident. When we talk about the Declaration of Independence, we talk about ideas and what we believe in and how we project ourselves to be. We talk about things like life and liberty and happiness. This is very much wrapped up in this thing we call health. Because if a person knows that they can get health insurance, then that person's free to leave their company and start their own business. They have liberty. When they're wrapped up into their company's health insurance policy in particular, they really have no freedom. So as we solve this riddle of health care, I believe we're answering more of these questions that are wrapped up in this Declaration of Independence. What we have to overcome is this very angry crowd of people here, these very confused group of constitutional people here who just believe if it's not in the Constitution, then we shouldn't have to pay for it. And we have to work on our semantics. This is called the single-payer system. Single-payer system, the government being the payer. There's also other themes. Within the single-payer system, you can certainly buy your own insurance policies, but everybody, every American is guaranteed access, and what I call front door access. You can go to the front door and see your doctor when you need to see your doctor. Wherever there's a single-payer system in place, whatever that country may be, they live longer and the health care costs are less. And that's not in debate. So my name is Scott Donaldson. I'm running for Congress. Single-payer system is where we need to be. Single-payer system is the way we solve this healthcare riddle that we've created in this country. Every other country has a single-payer system. Whenever that single-payer system is in place, they live longer and it costs less. The way we fix this economy, the way we make this country freer and safer, is we fix the healthcare debacle. I'm Scott Donaldson. I'm running for Congress. I believe in a single-payer system.